There's no relief in sight for the UK's season of strikes. After a crippling nurses' strike on Tuesday, 3 main ambulance unions in England, Wales and Northern Ireland are to stop work today. Major disruptions are expected as paramedics, call handlers, emergency care assistants and technicians go on strike. Late-stage labour and injuries will not be responded to, though unions say life-threatening situations like cardiac arrest will be answered. Ambulance workers are demanding a pay rise above inflation and a plan for recouping lost earnings over many years. Ministers have urged the public to take extra care and suggested they avoid contact sports and unnecessary car journeys. About 600 members of the armed forces are due to take on ambulance driving roles. 150 personnel will provide logistical support. Industrial action by ambulance workers follows 2 days of strikes by nurses this month over pay. It's also been some of the busiest months on record for people attending accident and emergency departments. The UK is facing its biggest week of industrial strikes in recent history. Ambulance workers, customs and immigration staff, bus drivers and postal workers are all staging walkouts. Nurses Union boss Pat Cullen urged the government to resolve the crisis before Christmas, but there's no sign of a breakthrough between the sides. Prime Minister Rishi Sunak has insisted he will not back down against striking workers. Meanwhile, public opinion pollster YouGov has found that the nurses and ambulance strikes is backed by nearly 2/3 of the British public. 66% of British public says it supports the nurses' strike. 63% back the ambulance strike. The strike by firefighters has 58% support, and even the strike by teachers supported by 50% of poll respondents. Well, joining us live to discuss this in more detail is Alex Isat, live in London. Alex, there's clear signals here that the UK health system has been pushed to the brink with these strikes. Tell us more on the situation.
Yeah, absolutely it has. So I am here at the London Ambulance Service. Now you can see the huge unison sign behind me. However, they are not officially on the picket line on strike until midday today, and that'll be midday until midnight. But a lot of the other trusts who are either through GMB or Unite have already been on strike this morning or will go on strike later. So it is a mix throughout the day. And what we do understand is that every trust has been working with its own government, with its own council, and its local police as well, to have different contingency plans. So the contingency plan here is different from the one on the East Coast and so on and so forth. But ultimately, the whole of the trusts themselves just have the same problem, that they want better pay and they also want better working conditions. It isn't always just about pay. In fact, many of these strikes that have been ongoing for the nurses, for the rails and for the ambulance workers are about how they can change the way that they work, because the role has changed completely since they started. We understand here at the Ambulance Trust and the Ambulance Service that it's not about actually getting people into the jobs. They have people wanting to come in, but it's about retaining them, that there is a very unhealthy work ethic for some of them, and they want to change exactly how they're looking after patients. With ambulance workers, there are still a lot of people are on hold. 999 call handlers are working above and beyond, and they just want to be acknowledged from the government. But at the moment, the government is in a real stalemate position. They are suggesting that they won't be talking about pay. They are happy to talk about working conditions, but not about pay. So that means that this is going to continue rumbling on throughout December, and it's likely that it will continue through to January as well. And generally, the public, as you say, are supporting them, but there seems to be this fine line between the government and not just the ambulance, but all of the unions that are trying to push to have the government at least acknowledge that something does need to be done within the NHS.
Alex Isat, many thanks for your insight there.